Cadasil is a small artery disease of the brain. Cadasil is an hereditary disorder. If the diagnosis has been made in one subject, the risk to have the gene in his or her children is about 50%. Cadasil is a disease of smooth muscle cells within the wall of the small arteries penetrating the brain. The disease is responsible for different types of symptoms. Migraine with aura is one of these symptoms and is detected in about 1/3 of subjects, mainly between 20 and 40 years of age. Most patients, more than 2/3 of them, will present during their life acute ischemic stroke, motor deficit, language disturbances of acute onset. They can be transient or can lead also for some deficit. These transient ischemic attacks or stroke are usually observed in the absence of vascular risk factors. After years, the disease can be responsible at the late stage of the disorder, usually after 60 years of age. The disease can be responsible for gait disturbances, balance troubles, and can lead progressively to some cognitive impairment with memory deficits, and sometimes it can lead to a very severe clinical status at the really late stage of the disorder. But we see also in the families affected by Cadasil that the expression of the disorder is extremely variable among individuals, even in the same family with the same mutated gene. The diagnosis of Cadasil is usually suspected after the discovery on MRI of white matter hyperintensities in the brain. The presence of these white matter lesions does not signify that the disease is severe, and the extent of these white matter lesions is not related to the clinical severity in Cadasil. The most severe lesions in Cadasil are lacunar infarctions, which are responsible for small holes visible on MRI. In presence of white matter lesions, the diagnosis of Cadasil cannot be confirmed only with the presence of white matter lesions. You need for that a genetic test. And this genetic test shows a mutation in the Notch3 gene, and all mutations in Cadasil should lead to an odd number of cysteine residues in the external part of the Notch3 protein. This is very important, and you should check that the genetic test actually shows this mutation responsible for alterations of the number of cysteine residues to ensure that the diagnosis of Cadasil is certain. The Notch3 gene and mutations in the Notch3 gene responsible for Cadasil have been discovered in 1996. Today we have animal models of the disorder, and different preclinical studies are performed now on these animal models to search for a treatment. We are also now ready because for doing a clinical trial in this disorder, because we have accumulated data during the last decade concerning the clinical course, the MRI lesions, and the predictors of clinical severity in the disorder.